welcome back, Dr. John. Today we're going to talk about how we diagnose neuropathy at Gonstead Physical Medicine. The first thing we're going to do is when you come into the office is we're going to take a detailed case history because we want to determine the root cause of your neuropathy. Is it coming from an injury, from nerve entrapment? Is it coming from diabetes? Is it coming from an autoimmune condition? So we want to determine the root cause, and how we get some background on that is we take a detailed case history. When we're done with that, we're going to do a palpation exam of the spine, looking for subluxations, nerve entrapment, nerve compression, and also we'll do an exam of the hands and the feet because that can create bones out of alignment, compressing the nerve or creating subluxations. When we're done with that, we're going to do an exam that focuses on sensation. Can the patient feel certain things? Is it normal, is it deficient, or is it moderate? So the first thing we're going to do is we're going to test the patient for a pinwheel test, and we'll actually use the pinwheel to see if they can feel this. Is it normal, is it deficient, is it moderate? When we're done with that is we will test for what's called fine touch, and we use this nice, really thin, fine-touched instrument to see if the patient can feel this. And some patients can't feel that fine touch. Then when we're done with that, we're going to test to see if the patient can have the sensation for temperature. And we use this very cold probe to see if the patient can actually sense temperature or coldness. Is it moderate? Is it normal? Is it deficient? Then we actually use a temperature gauge, and we actually monitor all the temperatures of the toes and the fingers to see if there are any discrepancies in temperature. When we see higher temperatures, it gives us an indication of inflammation. Now, when we're done with all that, we are not done. We will use a great modern technology called thermography. Now, thermography is amazing because it'll measure the surface temperature of the skin on the hands and the feet, and it has the ability to convert it to an image, and it will show us where there's decreased nerve flow, decreased sensation, and tissue damage. So as we come up to a thermography image right here, it should be bright. Now this is an image of the toes and the foot, and you can see the brightness in the back of the heel looks fine, but once you get to the toes, you can see how dark that is. That's indicating inflammation, which is probably due to lack of blood flow and lack of nerve supply there. Now, when we're done with that test, we're really concerned about blood sugars because sugars create tremendous inflammation in the body and kill nerve tissue. So we're going to do blood tests. We're going to look at your blood glucose. It should be around 100. If it's higher than that, we're concerned. We'll also look at your A1C. If your A1C is about 5.5 or higher, we're concerned about that as well because you might be having too much sugars that is contributing to your neuropathy. I'm Dr. John, Gonstead Physical Medicine. If you have any signs and symptoms of neuropathy, remember it's the tingling, burning, pain, numbness, lack of sensation in the hands and the fingers. You want to come in and get evaluated as soon as you can so it doesn't progress. I'm Dr. John. I'll see you in the next video.